Now, let's listen from our health director, Philip. Philip will talk about the most recent information about COVID-19 and how this is affecting the community of Clackamas County. Go ahead, Philip.
Thank you, Maria. Oh, great, and the slides are up. Before we start with the slideshow, I just really want to express my thanks. Thanks to everyone for joining today. As Public Health Director for Clackamas County, I hear from our team members working directly with residents, community members, their families, working with folks that have been diagnosed with COVID-19 or exposed to the virus every day. This response, it's certainly gone on for a lot longer than any of us ever would have imagined. And, I think that, having this dedicated time, I really appreciate the Board of County Commissioners wanting to hear from our Latinx community members about how the pandemic is impacting them. This Spanish-speaking town hall is really, really important because we know that our Latinx community members are disproportionately impacted by COVID-19. So next slide, please. This is our weekly case data. So this just shows over time since the beginning of the response, the number of cases for COVID-19 we've had each week. And right now we are seeing a surge in cases. Oregon has some of the lowest hospital capacity in the country. And that's one of our primary concerns for why we have restrictions around schools and businesses, really wanting to make sure that our healthcare workers are not becoming more overwhelmed than they already are. And while this is a glooming picture, as we're in the thick of this surge in cases, there is hope in the way with news of the vaccine arriving and going to be given to the first healthcare workers in Oregon as early as this Wednesday. Next slide, please. Here are the metrics. They're fairly new in the past couple of weeks. These are metrics for reopening schools and businesses. They are more science-based. They're based on a lot of lessons learned from the past few months of the response and through a lot of local advocacy at the county that we've done with the state health department and with the governor's office. In the summer, in early fall, we were in more of the moderate level in terms of these case data, but right now our county is in the extreme risk category that you see to the far right. Next slide, please. So here you can see our current metrics, the extreme category, over 550 cases per 100,000, and that's looking over a 2-week period. And then our test positivity rate is 8.3%. So out of all the tests that are completed, 8.3% of them over the past 2 weeks has been positive. And we know that testing is one tool. I will note that yes, we have increased access to testing. There are more folks getting tests, but I think what's really important to note is that the state of Oregon has some of the most restrictive criteria for getting a test. So while there's more testing, we're also seeing more folks that are symptomatic or that have been exposed to the vaccine requiring a test. And this is a good indicator of community spread. Next slide, please. This just gives this table. I won't go through all the different items here, but this does give you a list of under the extreme risk category currently for Clackamas County around businesses, what's allowed and what is not allowed. So a few of the significant changes that we hear about frequently is around restaurants, that they can provide outdoor dining and takeout, but not indoor dining right now. Retailers need to be operating at 50% occupancy. And then we hear a lot about gyms and fitness centers. And yes, there's a lot of benefits around the physical wellness of gyms, but this is state guidelines, and the decision's been made at this point that gyms need to be closed. Next slide. I think that this heading, and I have a few slides to share. While you may not be at risk for COVID-19, people in your life, they are. We're seeing with our local case data here that folks in their 20s and 30s are really driving the increase of our local cases. And the concern is that when folks get together and socialize or need to come together to work, that they spread the virus to other folks that are at higher risk, people of color, older adults, and individuals with pre-existing health conditions that put them at risk to be hospitalized or potential death. Next slide, please. So we often mention folks with underlying or pre-existing health conditions. This is a visual that shows you for our Clackamas County cases, the breakdown of the different types of health conditions that individuals who test positive for COVID-19 also have. So if you have cardiovascular disease, you're 5 times more likely to be hospitalized. And if you have chronic liver disease, you're 4 times more likely to be hospitalized. Next slide, please. People of color in Clackamas County comprise of roughly 15% of our population. And one of the health disparities that we've really been looking at closely since the beginning of the response is that people of color make up 45% of our community's cases for COVID-19. Here we've circled just within the Latinx community to show the Latinx community comprises of 8% of our population, whereas this group makes up about 20% of our cases. So, when we talk about health disparities, inequities, the COVID-19 pandemic has certainly shown us that that is true as a societal issue that we're, need to address. And then next slide, please. I understand that holidays is a very important time for family and friends. Traditions and folks have the stress of the season, no matter what you celebrate or how you celebrate. My role as a public health official is to make sure that people can do these activities as safely as possible. So we have some suggestions here. I think ultimately it's to recognize that probably everything that you usually do, this just isn't a typical year. So really try to focus in on those things that really, really matter to you and to your family and to your friends and loved ones. To do what you can so you can enjoy that activity, perhaps on a smaller scale. That if you're going to do something to celebrate New Year's, we'd recommend reducing your exposure to others the week before and the week after. We really want to make sure that folks are being diligent to continue to follow the public health guidance. If you're not feeling well, even mild symptoms could be of a concern. So please, if you're not feeling well, reduce your interactions with other people. Wear your face coverings if you're interacting with folks outside of your household. Keep your distance and really try to reduce the number of people you're interacting with. Next slide. And then finally, we have a whole lot of resources. We've worked for months now to provide these for the community. A lot of them are available in Spanish. One of the most important resources is our new after testing guide. It's for businesses and individuals for what to do after you've been exposed to COVID-19, what to do after you've got your test and are waiting on your results. And if you test positive or if you test negative, it provides you with really helpful information on next steps. For businesses, it also provides information for what employers can do to protect their workers. And that is the background information that we wanted to provide. Thank you.
Thank you very much, Dr. Bro. We'll be back in case we have any comments or questions from the audience. We also like to welcome our commissioner from the Clackamas County, Mrs. Martha Schrader. Commissioner Schrader, do you want to share some words?
Sure, I've been on mute because I've had barking dogs here for a while, which is why I was trying to keep them quiet a little earlier. I'm so glad you're all here today. The county cares about your families and your health. And we're hoping that this conversation with you will help you to continue to be healthy and safe as we go through this holiday season. So welcome, everyone. And thank you for tuning in to us.
Thank you very much. We also like to welcome Commissioner Sonia Fisher. Welcome. Now, we like to talk about invitees. You. We are going to be here till about approximately 5:30 or until we don't have any more questions. Remember, you have several ways to make comments. You can use the function, lift your hand in the Zoom bar. This is located either on the top or lower part of your screen. And if you just join us by phone, you can press the star sign followed by the number 9. You can also send us an email. And the link is clarkcallnews@clackamas.us. And you can write it down at the chat square, clarkcallnews@clackamas.us. If you have any questions for our health director or any of the commissioners, you can ask the questions in live. You would unmute your microphone so you can speak directly with the commissioner or with us, or you can put your comments on the chat. Either way you feel more comfortable about asking questions or making comments. While you're formulating questions or comments, let's read some of the comments that we received through the email about COVID-19.
Mm-hmm.
Some people got here late to the last meeting we had. So we have so many questions, we were not able to answer all of them. So I'm gonna read some of the comments that we were unable to answer last time due to time. This is coming from Angela with a question. It says, the state of was asking me if there was any availability for COVID-19. Do we need them? a quick test is available for everyone. Where can we get the testing for vehicles in our county? It was hard for me to get a test when I needed it. I was told I was not able to get a quick test. Is it possible that reopening allow for more testing? Can our county support that? This is a comment from Angela. Director, do you have any for Mrs. Angela?
I had a little bit hard time hearing, but I know I did hear that there was a question around testing. Where can we get access to testing? You know, the county's website, we do have on the testing page, there is a helpful resource where you can type in a location and it will help identify where you can access testing. You know, Clackamas County Public Health, we really rely on our healthcare partners to provide the bulk of the testing, either through hospitals or local clinics. But we also have contracts with a variety of other partners that go out into communities in high-risk setting and provide testing too, especially if there's been an exposure. We've done quite a bit of outreach to farms in the community, other workplaces where folks need quick access to testing. Regarding the rapid test, you know, we're seeing that there are, while that's a nice quick screening tool, there are some barriers. The federal government does require that a licensed healthcare provider administer those tests. If someone does test positive, we also highly encourage folks to get the other test that gets sent to the lab. So yeah, it's still got some different barriers and constraints around being able to easily test everybody.
Thank you very much, Director. Question, perspective. Thank you for how the community can access the station available. How would this be distributed? This opportunity for communities who are disproportionately affected.
For the vaccine distribution, so I will tell folks, I've been telling folks it's going to be a while before everyone has access to the vaccine. We're very excited that this week on Wednesday, we're anticipating the first healthcare workers to have access. Oregon's received initially 200,000 vaccines, and this is a 2-dose vaccine. So you're really looking at 100,000 healthcare workers, and then a portion of that is also going to go to some long-term care facilities. The governor has established a COVID vaccine advisory group that is still being recruited for. You can find more information about that on the Oregon Health Authority's website. And after healthcare workers, long-term care facilities, then the focus moves to other priority groups. This includes communities of color. This includes essential workers and individuals at higher risk, such as older adults and those with pre-existing health conditions. The process for how that will all move forward is really going to be through this advisory committee that is just now starting to get organized and convene and identify new members. So I would say a lot more to come. It's great news that in December we're going to get a few folks vaccinated, but we also don't know how long it's going to take and how much vaccine and when. All we know is the 200,000 this month.
Thank you very much, Director. Anybody in the audience have any comments or questions? Again, you can do it live or you can write your comment on the chat square or you can email us. We're gonna go to another question that we received by email. The question is from Sarah. One of my main questions would be, when would children be allowed to go back to school? I heard that January 5th, there's going to be a new evaluation that's going to change everything. I have a kindergarten who would love to start school and to meet new friends. Also, I have a boy in third grade. He used to hate school. Now, more that he's at home, he's not doing well. It's boring being at home, sitting in front of the screen. We have a lot of parents at home, not only working, but trying to help their children who have to go to school. I don't know if any of the commissioners or Director Philip would like to answer that question. I'm sure a lot of parents are asking the same question.
Well, I'll start and then others feel free to add, but yeah, so I did share those metrics earlier, where we're in the extreme risk category with the current surge in cases. So with those metrics, they align with school reopening, and currently we do not meet those indicators to allow in-person instruction. I think the state has, really been direct that they are looking at the metrics, they are looking on what they're seeing. I think that there, is potential for the metrics to change. I am hopeful that we will get through kind of this winter surge of increased cases, and with vaccine coming down the pipeline, I'm hopeful that we can get kids back in school. I think it's really, really important. But currently, the metrics that are in place right now requires comprehensive distance learning and some limited in-person instruction for students that have specific needs.
Thank you very much, Director.
Director?
We're going to take another question from the chat. This is from participant A. Is there a plan to limit the amount of how much companies can charge, like Uber Eats or Red Hot, how much they can charge a restaurant? Those fees are very high, and our small businesses are losing money with every order. The city of Portland has already passed something to restrict how much these companies can charge. Has Clackamas County considered something similar?
So I'll go ahead and chime in, but maybe Commissioner Schrader would like to
Sure.
feedback. I am not aware of an effort in Clackamas County to address this, and I didn't know about what Portland was doing. So thank you for that information. Why we like to have these listening sessions so that we can hear what's important to our constituents and learn what's happening. So Commissioner Schrader is connected very much so with our businesses and our chambers, and she may have more information than I do.
I don't at this time. However, I do know with takeout being how we've been told to, if we want to support our restaurants, this is the first time I've heard that there have been restrictive fees from some of the delivery services. So I think it's something we should probably take a look into. And I think it's a question for our North Clackamas Chamber of Commerce, which I can get on the line and do that. So, but it's good to know what Portland's doing, because we haven't acted on anything of that.
Thank you very much, Commissioner. Another comment from Juan
Yes,
Hernandez.
Commissioner Paul Savas here.
Go ahead.
I did want to just add that I have heard of a business here in Clackamas County, Milwaukee area that is actually claiming that might be a reason it's going to force their closure of their business, because they are limited to takeout and the prices are so high that they're not competitive.
Yeah.
And they're close enough to Portland that they are impacted for that very reason, where I think maybe businesses that are farther away from Portland may be not subject to such competition. So, but I think we probably should look into that, and I'm happy to find out what's going on. And if I could ask the caller, what area do you live in where you experience that or you're aware of? There you go. Okay.
Okay.
Milwaukee.
Milwaukee. Okay.
Are there any other participants, attendees that have heard the same thing as well from other parts of the county?
Oh, Grandma's Corner.
Muchas gracias, comisionados. Nos
Thank
mantenemos
you, commissioners.
para ver si hay más
So we
comentarios acerca del mismo.
will see if there's any more comments in regards to the same question. Now, Juan Hernandez has a question. Our Latin community is afraid of having the vaccination once it becomes available. How can the doctor let the community know how important this vaccination is?
Well, maybe I could jump into that a little bit. I think it's extremely important. One of the issues is they call it herd immunity. And you have to have a significant people who have been vaccinated in order to really limit the spread of the disease. As a layperson, that's my understanding. Philip may have a more technical answer to that. But I honestly think the county has a role with our public and government relations. It's one of the reasons we're doing this talk tonight. But we will have a role in getting that information out to all of our community, as well as Spanish speakers, Russian speakers, so on and so forth. We're going to be committed to get the information out and the education out about how important this is going to be for your families and public health as a whole.
Very well said. Thank you, Commissioner.
Yeah.
Schrader. Yeah, I think, this is going to be gradual in terms of folks getting to the point where you have the decision to make about this vaccine. We're going to learn a whole lot. gives me confidence that our healthcare workers are excited and want to have this vaccine. I think we have a role as a community to show how it's safe and effective, that, you know, how quickly it was developed at these record speeds, while it also didn't compromise the safety. You know, and we'll continue to message that. We'll continue to learn and communicate that out. But, you know, the vaccine's only going to be effective as a community if we all
Indeed.
take. And if we want kids back in schools, if we want economies moving forward, if we want to do the things that we were able to enjoy in the past, vaccine is going to be one of the best tools we possibly have available to realize that hope for our county and for our world.
Muchas gracias.
Thank you very much.
Recuerde que estamos aquí para usted.
Remember that we're here to
Podemos
serve you.
escuchar de usted,
We would like to
en voz
listen.
alta, o puede hacer su comentario en el cuadro de
You
chat,
can
o a través de
do it
correo
live through
electrónico.
chat or through an email.
Voy a ir a otro correo electrónico
We're going to another email from
de un residente de Happy Valley,
resident from Happy
de
Valley
Milligan, que dice,
in Milligan. It
las
says
restricciones impuestas
the
por la
restriction
gobernadora
imposed by
no
the
están
governor
en consonancia con el nivel
do
de riesgo
not,
que el COVID-19
the
representa para nuestra comunidad.
COVID-19 doesn't represent
Ya que
much
Oregon
of a risk to
ocupa
our
el
community.
quinto lugar más
Oregon
bajo del
is number
país
5,
en
the
términos de
lowest
casos por
in
cápita.
the country in cases
Nuestros
per capita.
hospitales están
Our
abrumados,
hospitals
pero
are
nuestros
overwhelmed,
ciudadanos
but our
definitivamente se
citizens
sienten abrumados
definitely
en
feel overwhelmed
múltiples frentes,
in
ya que se ven
multiple fronts
obligados a soportar
because they're
la
obligated, having
limitación
to
del
put up
gobierno,
with all
que
this
es
government
arbitrario y
limitations
dañina.
that is arbitrary and harmful.
Era comentario, no era pregunta.
It was
Pero
not a
todo-
question, it was
todo
a
es
comment,
importante.
but it's all important.
Commissioners, were you able to hear those, that comment, the translation okay?
It was somewhat hard to hear.
Okay, the comment just in summary had to do with the number of cases per capita in Oregon compared to the rest of the country is pretty low. And so, yes, hospitals can be overwhelmed, but there are other ways of overwhelm that's happening in Oregon. And so it just speaking to thinking about all the other impacts of COVID beyond hospital overwhelm.
Okay.
Gracias, Martín.
Thank you, Martin.
Tenemos otro comentario de Juana.
Another
Hernández.
comment from Juana.
Sabemos que los campesinos son
We know
unos
that
de los
farm
más
workers
afectados.
are some of the most affected.
Y Noemí,
And
parece que a lo mejor
Noemí
tiene problemas con el audio de la
looks like
traducción.
she's having
Dice,
some
gracias,
audio difficulties, but
podría
she's saying thank
traducir
you.
las respuestas.
Can you please translate the answers?
Entonces voy a poner la instrucción acerca de
I'm going to put instructions
interpretación para seleccionar interpretación.
so you can select
Gracias, Martín.
an interpreter. Thank you, Martin.
Mientras vamos a ir a otro comentario.
Meanwhile, we're going to take another comment. This one is from someone from the incorporated, from the Clackamas County. This is from Steve. In the county, not incorporated in the Clackamas County, children go to primary school and go in Lake Street. This is, they do it remotely. The quality of the education is excellent. And of course, we would rather have in-person instruction when there's no COVID. Our district is doing the best job that they can.
Commissioners, it's in summary is talking about the great work that teachers and educational professionals are doing. And this in particular talked about the school in Lake Oswego area. I don't know if you want to talk about education and impacts on education with COVID-19, but that was what it was a comment.
Well, I think it's been a very difficult time for everyone, particularly when it comes to the education piece, because some families are lacking access for online schooling. Online schooling, or education doesn't work for every child. I think it's been very, very difficult. However, you also want to maintain the distance from the virus and not put teachers and children at risk. So it's kind of a two-edged sword, and it's a balance of how we do that. I'm hopeful that once we actually move ahead with vaccinations, that we will see a movement to opening our schools sooner than later at this point in time. But for me, from what families have been saying to me, it has been extremely difficult. But the fact remains that we are in a surge right now of infection, and we have to be extremely mindful of that.
I'd also like to add that we have over 150 schools in Clackamas County.
Right.
And
Yeah.
I appreciate the comment. Our schools have worked incredibly hard, figuring out in the past year how to move to distance learning, while also behind the scenes, they've all submitted plans to the state, all 150 of them, for how will they approach school reopening if they have a case or potential case of COVID-19 in their school. What will they do? And at Clackamas County Public Health, we've dedicated staff who have reviewed all those plans, provide feedback. We're meeting with the schools regularly, still preparing. So once we get through the surge, we will be ready. We will be ready as a community to support our schools.
Muchas gracias.
Thank you very much.
Las instrucciones para el audio o
The
para hacer
instructions for
comentarios
audio to
están
make
puestas
comments,
en el cuadro de chat.
you can find them in the chat section.
Lo siento que tengamos problemas con el modo de
I'm
interpretación.
sorry, we're
Lo
having
practicamos antes
difficulties
de
with
esto
interpretation
parecía que
mode.
todo estaba bien.
We practiced this beforehand, and it looks like everything
Agradecemos su
was working
paciencia
well.
y si
And
quieres ir al cuadro de chat
thank you
para
for your patience.
asegurarse
If you go to the
que lo que va a
chat
hacer es de seguir las instrucciones para que
and
podamos recibir
follow
sus
the
comentarios.
instructions
Gracias.
to make sure that we get all your comments. We thank you.
Voy a compartir otro comentario.
I'm gonna share another
Un
comment.
residente que trabaja
This is
en una
a
nursería
resident that
del
works at a
condado de
nursery
Clackamas.
in the Clackamas County.
Hago
County.
todo lo posible para
I do everything
seguir las
possible to
recomendaciones
follow
del
all the
CDC
recommendations from the CDC
y los profesionales de salud pública.
and the health professionals.
Hay varios en mi área de trabajo,
There's several
algunos
in my
patrones
work, including my employers,
que no están enforzando
that
las reglas
are not enforcing the
y
rules.
eso nos pone a todos en riesgo.
And this puts all of us at
¿Qué
risk.
recomendaría el condado o
What
tienen
would
ustedes
the county recommend?
alguien que
Or
puede
do you
dar
have
instrucción
someone that
a
can
los
go
dueños
and
de
instruct the
las granjas, de
owners
nurserías,
of
para
these
asegurarse
nurseries or
que están
farms
manteniendo a todos
to
en
make
una fuerza
sure
laboral
that the
seguros
whole labor
para que no se
force
siga expandiendo
it's safe, so COVID-19 doesn't continue to expand.
Thank you for expressing that concern. Yes, anyone, and I really appreciate you mentioning that you've been following all the public health recommendations, and it's tough. It is tough to have our diligence and do that long term, especially in the workplace. If folks do have concerns, there's multiple options. So if you're an employee and you're concerned that your employer isn't following the rules, you can contact Oregon OSHA. They're probably the best resource for employees to make sure that their workplaces are safe. General complaints about businesses not following the rules can contact EH@clackamas.us. That's EH@clackamas.us. And that goes to our team here locally, and we really focus on education for businesses, for community members. We're getting a lot, I'll tell you, and we do our best to prioritize and reach out to folks and help provide folks with resources and tools.
Muchas gracias, director.
Thank you, Director.
Si sigue teniendo problemas con el
If
audio,
you are still having
existe
difficulties with the
la
audio,
opción de silenciar
you can either
audio original.
silence the original audio.
Seguiremos haciendo todo lo posible para
We will continue
corregir
to do our
los
best
problemas.
to fix this
Agradecemos su
this
paciencia.
issue. We thank you for your patience.
Otro comentario,
Another comment
el cuadro de chat es de
from the
parte de
chat.
Noemi.
This comes from Noemi.
Miro unos números de
I see some
meeting
numbers.
host.
Meeting
¿Será que tengo
host.
que salir y agregar estos datos? Porque lo único que me pide
So I need
es
to
entrar mi
leave
nombre y
the meeting and then
email.
come back again because it's only asking me for my
Parece que
name
es alguien
and
que a lo
email.
mejor está teniendo problemas de
I think
ingresar completamente
I
a
think
la
somebody's having a
conversación.
difficult time to
Probablemente necesita
sign
salir.
into the
Está
conversation.
escuchando,
Noemi,
puede
if you are
intentar
listening,
salir de la
you can try to
reunión y
exit the
volver a
meeting
entrar.
and then come back, join the meeting again,
Y luego seguir las
and
instrucciones que
follow.
están en el cuadro de
Just
chat
click the link and then
para
follow the
elegir su
instructions
idioma de
in the chat,
preferencia.
and then you can select your language
Y
preference.
sentimos muchísimo que estemos teniendo
We
problemas con el audio.
regret that you're having difficulties with the audio.
Voy a ir a otra pregunta.
We're going to take another question. This one's from
De otra persona.
another person.
¿Quiere saber si en este momento están
I would like to
recomendando
know
los
if
profesionales de
at
salud
this time,
pública que
do health
no
professionals
hagan viajes
recommend not to travel,
familiares, sino
not
estados? Hay
not
algunas
to
limitaciones
visit
que existen
family,
en este momento.
but to travel to a different state? Are there any restrictions at this time?
For travel right now, the governor has issued voluntary guidance to really limit any non-essential travel right now.
Right. And I'd like to add to that because I haven't seen my grandson in Boston for a year. And I was going to try to travel, but I decided that based on what the governor has asked us to do and based on the risk that I will not be traveling. I really felt that the risk outweighed the benefit, and that also as someone who's a commissioner, I have to lead by example. So I am really staying home this Christmas, but I can relate to people with how difficult it is because I'm just seeing this little boy on Zoom. And when he talks to me on a screen or a phone. So I don't know when I will be able to actually see him again. But I think that I think it's a wise thing to not take the risk. Should you travel to another state, you need to take precautions. And you can go to the medical website of, they're the big clinic in Minnesota. What are they, Philip? Help me out here.
The Mayo Clinic.
The Mayo Clinic, yeah, it's the Mayo Clinic. They list protocols for travel to minimize the risk. And also you need to check in with the state you're traveling to. They may require you to quarantine for 2 weeks once you get there. They may say that you may not quarantine if you have a negative test. But all of that is dependent on the particular place you're traveling to. But right now, I honestly, I think we need to be cautious because we're in the middle of a huge surge. And like I said, it breaks my heart, but that's just the way it has to be right now for everyone's safety.
Muchas gracias.
Thank you.
Seguimos invitando a nuestra
We invite our participants.
Queremos escuchar sus comentarios.
We would like to listen to your comments. You can do it live. If there's something you want to know, something that brought you to this meeting today, you have some questions that haven't been answered, or you have any questions over the statistics or anything else, we would love to listen from you. And you also have an option to do it by chat or by email. You can raise your hand on the Zoom. You can find that on the upper or lower part of the screen.
Y parece que hay un comentario de Juana.
Looks like there's a comment from Juana. Thank you, Juana. The comment from Juana, as a community worker in the county of Multnomah in Clackamas, I see that the Latin community in Clackamas is having more difficulties receiving help when it comes to COVID-19. Is there something that the Clackamas County is doing to make sure that the Latin community has more access during this quarantine?
So, la pregunta es,
the question is, what is Clackamas County doing to make sure that the Latin community has more availability to the resources during this quarantine?
Thank you for the question. So through some funding that ends the end of this year, we do have contracts with several, I think close to 20 community-based organizations, culturally specific organizations. So folks that need to quarantine or need to isolate, and they need resources to help. So they might need rent assistance, groceries, laundry, whatever different types of supports that families might need in order to quarantine and isolate for the exact amount of time that we recommend. Those resources are available. We are really concerned in 2021 about our ability to still meet those needs. And I'll say the system right now is overwhelmed because of so many cases. It's just a large volume, and a lot of folks have needs, and we're certainly doing the best that we can. Our nonprofits are overwhelmed with trying to meet these needs. And then the funding ends in 2021, and we're gonna have a big challenge ahead of us. Certainly the commissioners are advocating at the state and federal level for additional funding to help support our communities during this challenging time. But right now, I'd say we're doing our best to provide the resources, and we do have some funding to support this work. in 2021, we're worried.
Yeah, if I could add, I would just want to say to the caller, thank you for your for raising this point. And Philip, you did a great job in answering the question. We not only do we agree that we have to have better connections and make sure we're doing our best for our Latinx populations, but we're just by virtue of having this town hall tonight and the one we had about a week ago demonstrates our efforts to do that. So we're hoping to build as many connections with you in the audience to have you answer or ask the questions, hear the answers. And so this is a great opportunity this evening to figure out how we can do a better job. So your ideas are extremely valuable. So we encourage any ideas you have to share with us. Thank you.
Muchas gracias.
Thank you.
Tenemos otra pregunta de
We have another
Noemí.
question from Noemi.
Mi pregunta es,
My question is,
después de que una persona fue
after a
contagiada
person
y
was
recuperada del COVID-19,
had COVID-19
¿será que
and
es
recover,
inmune por 3 meses?
are they immune for 3 months?
We do not have enough data to know that. In general, I would say after someone has tested positive for COVID-19 and they've isolated for 10 days and are no longer having symptoms, then they're unlikely to spread it to other people. That is good. We have seen a few situations where someone who has tested positive more than once. So the question around, do you have immunity after you get COVID and for how long is unknown. Mostly because this is still a new virus for everyone, and it's a very interesting virus that we're still learning a lot about.
Muchas gracias, Director Philip.
Thank you, Director Philip.
Otra pregunta es
Another question
acerca de
in regards to
alguien ha sido contagiado
when somebody has been
y
has
escuchado
contracted,
que representantes del condado de Clackamas
and I've heard the
les
representative
hablarán por
from
teléfono
Clark County
para averiguar
Folsom
con quién han tenido contacto.
to see who they had
Hay
contact with.
situaciones en que no escuchamos nada.
There's
¿Hay
situations
algo
we don't
que
hear
podemos
about.
hacer nosotros
Is there something
para
that we can
asegurar
do
que las personas
to make
con las
sure
que tuvimos contacto
that we
estén
had contact with,
notificadas?
are
El
notified?
condado de Clackamas se está encargando de eso.
County of Clackamas handle that?
I apologize, I couldn't hear that very well.
Yeah. So it is the question, how in the contact tracing, how do we ensure confidentiality and comfort in sharing those contacts? Is that the question? Because we had a hard time hearing.
The main question has to do with whose responsibility is it ultimately? Is the county in charge of contact tracing? Is that something that people have to take care of themselves? How does contact tracing work?
Okay, great. Yeah, so public health, Clackamas County Public Health and any local health department around the country is responsible for the contact tracing work. We really take confidentiality incredibly seriously when we notify folks that they've been exposed and only share the bare minimum information that folks need to know. The other part of your question, I'm sorry, I need a little bit more help with, Martine.
Can you hear me if I speak in English?
Yes, I can hear you, Maria.
Oh, okay. So I think the second part of the question was, is there something that someone who has tested positive could be doing in the meantime, waiting waiting for that contact from public health.
Yeah, that's great. Thank you. You know, we do encourage folks, and this is part of what we've started to communicate now since the increase in our surge in cases, that we're just having a tough time keeping up with so many cases and contacts to notify everybody as rapidly as we were this spring, this summer, earlier in the fall. So we certainly do recommend that once folks get their test results back, that you go ahead and if you know that you've interacted with close contacts and potentially expose other people, it is appropriate to go ahead and let them know that you've tested positive. And certainly they can call our number and contact us or their healthcare provider. Also businesses, you know, if a business, oh, sorry, I'll slow down. If a business learns that an employee has tested positive, it's really important that they share the minimal information to employees that meet that criteria of a close contact. So if you've been within 6 feet of someone for 15 minutes or more over an entire day, that would be a close contact. And it doesn't matter if you have a mask or not, or face covering. Masks are really, really important tools, but it doesn't make you exempt from being a close contact. And, you know, some suggestions folks are recommending, and I think it's great, is, you know, hopefully you're in contact with not that many people and physically, and if you are, that you're kind of keeping that list of folks that you have interacted with. So that way you can help your network of people. So in general, yes, there are actions you can take. Notify, once you test positive, go ahead and notify people you've been in close contact with. And if you're an employer and you learn of an employee that tests positive, notify your employees, and they, you know, if they're a close contact, they need to quarantine.
Muchas gracias por esas recomendaciones, Director
Thank
Philip.
you for those recommendations, Director Philip.
Otra pregunta es de
Another question
alguien
comes
que
from
ha tomado la prueba, se ha hecho la prueba
someone
de COVID
who
y salió
did the
negativo,
tested negative.
pero
However,
un compañero de vivienda
a
salió positivo.
roommate tested
¿Eso
positive.
quiere decir que esta persona tiene que hacerse
Does that mean
la prueba de nuevo?
that this person has to
¿Tiene que
retest
quedar en
again
cuarentena porque ahora
or
ha sido expuesto
has
a
to
alguien
quarantine themselves
que le salió la prueba positiva?
because they have been exposed to someone who tested positive?
So if you tested negative, but your roommate tested positive.
Yeah, if you've tested negative, but your roommate tested positive.
Yeah, is
Mhm.
there a need to quarantine, or what are the requirements, or do we need to retake the test? What are the requirements?
You would need to quarantine for 14 days from when your roommate tested positive. And in terms of getting another test, in general, the recommendation would be to wait a few days, see if you get symptoms. If you do get symptoms, contact a healthcare provider and discuss testing options.
Gracias.
Thank you.
Una pregunta de Noemí.
Another question from Noemi.
Debido a que no recibimos
Do
el segundo
they
alivio
will not
económico
receive the
por
second
medio del
stimulus
gobierno,
from the
¿será
government?
que exista un apoyo
Is there any other
o un apoyo
type
del
of
gobierno?
help at the state level or help from at the county level?
Since we haven't received a second economic relief from the federal government, will there be something from the state or from the county for economic support? Relief is the word I was looking for, relief. And I think this would be a question for commissioners to respond to.
So I'll go ahead and chime in. As far as any additional CARES dollars, we're keeping a close tabs on what our partners at the federal level are doing. And unless there's been breaking news that I'm not aware of, I believe they're still in discussion about an additional relief package. Really concerning to folks here locally that we've heard. So would love to hear how you feel about this, but the concerns of for rent assistance, for landlord rent assistance, for assistance for businesses that have been extra hurt during this this surge we've been advocating for that. And we've also been advocating for what's called a direct allocation, which means in Oregon, the first round of the dollars that came from the federal government, there were the larger jurisdictions such as Multnomah County, Washington County, and City of Portland that got money directly. In Clackamas County, we did not get that, and we needed to invoice our CARES expenses, and we got much less resources. I think our total was 17 million, and maybe Commissioner Schrader would remember how much Multnomah County got or Washington County got, but it was significantly more, or Philip would know, but we did not get adequate resources to help our community. So we've been fighting hard for that. And our congressional delegation is totally on board with wanting to help us, but of course they're one little piece of the pie in Washington, D.C. So Commissioner Schrader, I don't know if you have anything to add to that, or Commissioner Savas.
It's been really difficult, actually, because we have just as much need here as the other counties. And my hope is that the federal government, I know that they're negotiating now, and they're still not exactly aligned with what that package is going to look like. But I hope, given with what we're faced with as a local government and the services that we are required and morally required to provide, that they can come to some kind of an agreement so we can make sure our citizens are getting what they need when it comes to housing, when it comes to food security, when it comes to adequate medical care and access to services.
Gracias, Comisionada Schrader.
Thank you, Commissioner Schrader.
Any more chat?
¿Algún otro comentario o pregunta? Esta es su oportunidad de hacerle.
Any other questions or comments? This is our opportunity to directly ask questions to the public health director, Mr. Philip Joyner, or the commissioners. What else have you heard as far as the vaccination in your community? What other worries you have in regards to the immunization or anything else that has to do with COVID-19? We are here to.
Okay, Paul Savas, Commissioner Paul Savas here. I think my concern is that when the vaccine is available for widespread distribution to the public, my concern is that not enough people will actually take the vaccine. And I think it's really important that we not be afraid of the vaccine, that we have confidence in the system and have confidence in the testing, because if we do not, if there's not enough people that actually receive the vaccination, want the vaccination, then we run the risk of this pandemic lasting far longer than it would be otherwise.
Yeah, and I would echo that, Commissioner Savas. you know, when it becomes available, it's going to be very important for people to realize that it's been approved, it's been vetted, and that this is the one process that we have, I think, that will stem the tide of the pandemic, is to get vaccinated. And I do know from what we've been hearing that healthcare workers are prioritized. And Philip, you can jump in with this. Healthcare workers, long-term care facilities, people who, for whatever reason, older folks with conditions who might be a little more at risk. But I think in the end, everyone is going to really have to step up to the plate and get a vaccine.
Commissioner Schrader, I'm so sorry to interrupt. Could you please restate your response slower and in summary again, please?
Oh, okay. I just said that I concurred with Commissioner Savas, and that that people do not need to be afraid of the vaccine. It is going to be essential for public health to step up to the plate. The vaccine, as far as I know, and Philip may want to add to this, is going to be really initially for public health workers, first responders, long-term care facilities. So there's going to be a queue before it becomes available to the rest of us.
Thanks, Commissioner. I'd also add that,
Yeah.
you know, I am looking forward to Oregon's advisory committee, that we're able to do this in a thoughtful way that meets our state's needs with our values. And, you know, I agree that folks don't need to be scared of vaccine. It's going to be available in usual healthcare settings, pharmacies, and then we'll, you know, local health departments will do community events similar to how we do testing events out in the community. So it is something that we're really looking forward to once we get enough for everybody to have access.
Muchas gracias, Director Philip.
Thank you, Director Philip and Commissioner Paul and Martha. And basically, we heard that we do not need to be afraid of the vaccine. This is the best way to stop or minimize the effect of COVID, and to be able to get through this situation that we find ourselves in by following the public health recommendation, and also spreading the voice around the community. It is important that everybody gets the vaccine, and don't be afraid of getting the vaccine. We have a comment from Noemi. She has raised her hand as well. Noemi, go ahead. One second. We're working on this. Give me a second. Looks like we're still having technical difficulties with the audio, so we're really sorry about that. Well, if you can please, meanwhile, read what I have in the chat. Yes, of course. This is the question. How can we start the process of registering to be able to get the vaccine?
Big Philip.
That process is not yet developed or available yet. The hospitals, there's 4 hospitals that are going to receive the initial vaccines, and then they'll distribute them to the other healthcare workers. And then long-term care facilities. Every long-term care facility in the state of Oregon signed up to receive the vaccine, which was huge. So phase 1 is really in progress and moving forward. the process for how other groups and populations will sign up for the vaccine is not yet in place. But I'm certain that that will be widely communicated out, as it is.
Y ahora no está aquí con nosotros.
Okay, now we have Noemi with us.
Oh, sí, nada más quería saber,
Yes,
como dijo que no,
I
todavía
guess
no hay
you
lugar,
mentioned
¿verdad? Donde nos
that
podemos
there's not
registrar,
a
pero
place where we can go
¿cómo
register.
podemos,
How can we
darnos cuenta cuando ya
find
haya
out
lugares
once
donde nos vamos a ir, cómo nos vamos a
this
poder
places
registrar,
become
cómo va a
available?
ser, cómo está
How
programado
how
para
is
que
this
nosotros sepamos también
how will we
pues
know
tratar
when the
de
vaccine is
podernos registrar
ready
lo antes posible
to try to get the
por completo.
vaccine the vaccine as soon as possible?
Were you able to catch that? So how will people know when the vaccines are available?
Well, it's my hope that the state comes up with a plan to message that and get that news out there, along with the news agencies and the schools and the employers, that everyone will have, that there will be a plan to get the word out about that. So I would say that the state of Oregon's website would be one good solid resource. The schools would probably be, hopefully, be a resource to have that information when it comes out. But the message to the responsibility to get the message out will be determined by, will be the state and everyone else that determines to play a role in that. If some of you have noticed on some of the billboards around the state of Oregon, they have a yellow message about wearing a mask and being careful. So I'm hoping maybe if they use that same mechanism, having the billboards up, that will be maybe another place to know, number one, the vaccine's available. Number two, where to get it and when am I eligible. They might do it by age groups. So maybe the most senior citizens might be more eligible at first to get it before the younger populations. I'm not sure, but there's been talk about that. But pay attention, and we will post it on our county website as well. So there's another resource for all of you. So any of you who want to log into the county website, we will be posting that information as well.
Thank you.
Gracias por esa información.
Thank you for that information.
Me hace pensar otra
This
pregunta que me hizo
makes me
acerca
think
de
about a question
cómo es
that someone
que las
made.
comunidades pueden recibir la información.
How can
Tratándose
the
de los
communities receive this
letreros a los
information?
que se refería el comisionado
You mentioned the
González.
billboards.
Hay
Uh,
modo de que
Is there a way
estos
to
anuncios que uno ve por
uh,
autopista
those
sean traducidos a español
those messages can be
y a otros
translated
idiomas?
into Spanish or other languages? Is there a way these billboards can be translated into Spanish or other languages?
Are there translations in other languages?
I would think so. That should be very easy, and that should be part of our message. And maybe the county commissioners can contact the state and the governor's office to make sure that we do that messaging in as many languages as possible. There was another question earlier or opportunity, and I wanted to mention that same thing, that we need to start messaging things in multiple languages when it comes to the COVID crisis. So there was another opportunity earlier, and when we talk with our staff tomorrow and on Thursday, I think at least one of the three of us here, if not all three of us, will be conveying that message to our staff to see if they can't make that kind of a change and make that kind of accommodation, because it's important. You need to be involved. You need to be able to get the information in a way you understand it. And we need to make sure that the messaging, we had this conversation at the last session, sometimes our messaging is not very clear. And, we should try to make sure as best as possible that if we do message it in Spanish, for example, that the message is clear and well written.
Gracias. El comisionado
you.
Sabes comenta que es
Sure.
una buena idea y es una buena
Since this is a good idea, and this is a good opportunity for the commissioners and other colleagues can have this conversation with the state of Oregon and other staff members to have those translations available in multiple languages, not just in English. In general, all communication should be in other languages. It's important that the community receive information the best way they can receive that information in their own language, especially with something as important as COVID-19. Thank you.
Y lo siento que la interpretación aún esté un poco.
Sorry that the
Seguimos teniendo problemas
interpretation,
con el
we're
audio
still
y la
having
función de interpretación.
difficulties with the audio and with the interpretation function.
Bueno, quiero darles
Hello.
la última oportunidad para hacer
We
sus
want to
comentarios.
give you one
Pueden
last
hacerlo
opportunity
en
to
vivo,
make a comment.
usando la
You can do it
función de
live.
alzar la
You can
mano
use the function
en
of
el cuadro de
raising
chat
your hand.
a través
Um,
de correo
or
electrónico
you can do
o
it by email,
como usted
or
mejor se sienta cómodo.
the best, however you feel the most comfortable.
O alguna última
Any
cosa que tengan.
last question or comment from anyone?
Okay. En este momento.
Okay, at this time,
Sí,
¿Tenemos
perdón.
algo?
Sí, Noemi también quiere decir algo.
Noemi has,
Noemi, adelante, por favor.
she has something to say. Go ahead, Noemi.
Me gustaría
I would like to
ver si tienen
know
programado
if you have
los
scheduled
niños regresen a clases en este año escolar
a time for
o hasta el siguiente.
children to go back to school this year or the following
Do you
year.
know if children will return to school this school year or the following school year?
I'm really hopeful that we'll have children back in school for in-person instruction later this academic year. However, it really just, at this point, it depends on our metrics and if we can flatten this curve and see the surging cases decrease. So I'm hopeful that as a community, we can make it happen. But it really does, it takes all of us as individuals and as a community to come together to reduce the spread of COVID-19.
Pero como está ahorita la situación.
Well, given how the situation is, do you think they're gonna extend? Disculpe, no escuché lo último que dijo.
So given the current situation, do you think that virtual learning will be extended even beyond the school year or longer?
I don't think anyone really knows at this point. I mean, it depends how quickly vaccine access will move forward and our case rates going down. So I don't think anyone, including the schools, parents, public health officials, I don't think anyone knows yet.
Creo que no es seguro y no sabemos con certeza.
Okay, we're not sure. We don't know what's going to happen.
Los datos que tenemos sobre los casos.
But given how we're declining, we're hopeful that we'll get through this. But also, we have to take into consideration this is all of our responsibility. We have to follow the recommendations from the professionals, and so we can go back to our daily lives and for children to go back to school. So let's keep the hope, and each one of us need to do our own. So, any final questions?
Quiero agradecer al
I want to thank the Director of Public Health, Philip. Thank you for joining us, and also the commissioners for all the information. It's very valuable to our community. And I will now hand the microphone to the commissioner so they can stay by and so they can close this meeting.
We're inviting commissioners to give some final thoughts to close the meeting.
Well, thank you all for joining us this evening. And thank you for your wonderful questions. It really gave me some ideas and gave me the idea to prepare questions in response to your ideas so that we can get the answers and making some connections with the state of Oregon for some of those ideas. I think these are really important. This is our second town hall with the Latinx communities. So we appreciate your attendance, and I'm actually think that we ought to keep on doing this. This is really wonderful. And the fact that the community yourselves are showing interest and all the good ideas that you're raising, I will be advocating for more of these. I thank you for asking the responsible questions with regard to COVID-19 and keeping our community, your families, our families, everyone's families, your employers all safe. And I feel that's extremely valuable. I wish you all a very, very safe holiday and a very, very happy new year. And let's just hope that next year is much better than 2020. Thank you.
Yes. Muchas gracias a todos y con eso.
Thank you, everyone. And so we are done with this meeting today. Oh, Merry Christmas and Happy New Year. Goodbye.